Signs and symptoms of mind control and trauma. Understanding the signs and symptoms of mind control and trauma is essential for recognizing and addressing these harmful practices. This lecture will cover the common indicators that someone may be experiencing mind control and trauma and how to identify these signs. Psychological signs and symptoms. Psychological symptoms can manifest as changes in behavior, thinking, and emotional responses. These signs may include confusion and disorientation. Victims may struggle to make decisions or think clearly. They might frequently appear confused or disoriented. Anxiety and fear. Persistent feelings of anxiety and fear are common. Victims may exhibit hypervigilance or an exaggerated startle response. Depression and hopelessness. Symptoms of depression, such as sadness, hopelessness, and lack of interest in activities, may be present. Low self-esteem. Victims often have diminished self-worth and confidence. Paranoia. A pervasive sense of being watched or persecuted can develop. Physical signs and symptoms. Physical symptoms may arise due to the stress and trauma inflicted by mind control tactics. These can include unexplained injuries, bruises, cuts, or other injuries that the victim cannot explain. Chronic fatigue, constant exhaustion or lack of energy. Sleep disturbances, insomnia, nightmares, or difficulty sleeping. Appetite changes, significant weight loss or gain, changes in eating habits. Somatic complaints, physical symptoms like headaches, stomach aches, or other unexplained pains. Emotional signs and symptoms. Emotional responses to mind control and trauma can be intense and varied. These may include mood swings, sudden and extreme changes in mood, emotional numbness, difficulty feeling emotions or a sense of detachment from reality, crying spells, frequent bouts of crying without a clear reason, irritability and anger, increased irritability, frustration, or anger, guilt and shame, overwhelming feelings of guilt or shame, often unjustified. Behavioral signs and symptoms. Changes in behavior can be a strong indicator of mind control and trauma. These signs may include isolation, withdrawing from friends, family, and social activities. Avoidance, avoiding certain places, people, or situations that trigger memories of the trauma. Compulsive behaviors, engaging in repetitive or compulsive actions to cope with stress. Substance abuse, using drugs or alcohol to numb emotional pain. Self-harm, inflicting harm on oneself as a way to deal with emotional distress. Cognitive signs and symptoms. Mind control and trauma can affect cognitive functions, leading to issues such as memory problems, difficulty remembering events, especially those related to the trauma, concentration issues, trouble focusing on tasks or maintaining attention, negative thinking, persistent negative thoughts about oneself or the world, intrusive thoughts, unwanted, distressing thoughts or flashbacks of the trauma, decision-making difficulties, struggling to make decisions or feeling overwhelmed by choices. Conclusion. Recognizing the signs and symptoms of mind control and trauma is the first step towards addressing and overcoming these harmful practices. Awareness and understanding can help victims seek the support they need and begin the healing process. It's important to remember that help is available and recovery is possible with the right resources and support.